Nurses are valuable leaders for creating opportunities to improve health equity. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter for AHA. Hospitals are putting patient experience at the center of what they do by developing new models of care and embracing new strategies to improve value and health equity. Priya Bathija, Vice President of AHA Strategic Initiatives, and Robyn Begley, CEO of the American Organization for Nursing Leadership and Chief Nursing Officer and Senior Vice President at the AHA, discuss the key role of nurses in addressing patient social needs and social determinants of health as hospitals take steps to drive health equity.
Thank you, Tom. Robyn, if you remember back in November of 2019, we presented testimony at the National Academy of Medicine's Future of Nursing 2020 to 2030 technical panel. At that time, we talked a lot about the role nurses and others are playing to address patient social needs and social determinants of health. And that seems like a lifetime ago. And so many things have changed as a result of the COVID-19 pandemic. It's really challenged us to drill down and to look at the societal factors that are influencing health and the role that nurses can play in addressing both the social needs of patients and the social determinants of their communities. How are you feeling about all of this?
Well, Priya, you're absolutely right. The World Health Organization, prior to last year, had declared 2020 to be the year of the nurse and the midwife. And boy, was it a year. Being on the front lines of the COVID-19 pandemic, the professional and personal qualities that nurses possess have really been reinforced because of this current climate. Some of the qualities of nurses, like being a trusted partner, we know they're solution-oriented. Nurses are equipped with valuable knowledge and insights. They're educated to consider the individual, family, and community health. Nurses have touch points with patients in the community, but also ambulatory and inpatient settings. We find nurses in every aspect of healthcare. We know nurses have been really challenged this year and in 2020, but we know how resilient they are. And finally, I think that nurses as agents of change, that's really a role that as science changes, as practices change in healthcare, the nurse helps their communities and their patients adapt. So these qualities I mentioned play a role in developing new and innovative healthcare models, and they help with trying out new interventions that support value and health equity.
I completely agree. And the pandemic highlighted many of the inequities in communities across the country. And so as we're looking at the role that nurses can play in trying new interventions and looking at new models, we just need to make sure that the strategies we take and the care teams we build to do these things address those inequities. Nurse leaders really have so many roles to play when it comes to improving health equity. One pathway is what we talked about when we gave testimony at that NAM panel, which is to improve health equity by addressing the societal factors that influence health. And Robyn, as you know, AHA developed a new resource, which is a framework of looking at societal factors that influence health that is intended to support hospitals and health systems as they take action to improve health equity. And the framework sets forth 3 distinct yet connected levels that address patient social needs, the social determinants of health of communities, and the systemic causes that are leading to poor health.
Yes, we already see how nurses really drive pivotal intervention in each of those levels of care.
They truly are. And we see nurses as a result of sort of all the skills and aptitudes that you laid out earlier, having a lot of roles to play in this work around societal factors. So, for example, they are heavily involved in screening and assessing for social needs in hospitals, clinics, at home, and in communities. And as you mentioned, Robyn, nurses are trusted partners. So they are the perfect people to have sensitive conversations with patients around social needs. And they have the skills to go beyond the assessment, to provide individualized care, to manage patient needs as they transition from a hospital to home or between other care settings. Nurses also play a unique role as they collaborate with social and community-based organizations to connect patients to resources that they may need outside of the hospital walls. And they really are in a perfect position to navigate patient relationships and bridge the gap between physicians and other clinical partners such as social workers or community health workers in making sure that care is coordinated for individuals. And they have a role to play in research and collecting data on health disparities. And last, building on what you said earlier about nurses being an agent of change, they also have a tremendous opportunity to advocate for change that we know our patients and communities need. And they can do that at the hospital system level or politically in their communities or nationally, like we do at the AHA.
Priya, I'm glad you mentioned national examples. Are there any local examples you can share?
Yeah, so when we provided testimony, we gave the committee quite a lot of examples, and I just want to highlight two that we shared last November on this podcast. The first is from Regional One Health in Memphis, and their nurse leaders designed and spearheaded a program that addressed the social needs of the hospital's uninsured population. They put together a team of nurses and social workers that partnered with community organizations to make sure that individuals with complex health and social needs had access to not only the clinical care they needed, but also behavioral health, social services, and employment support. These patients got what they really needed to help them achieve health. And in just 2 years, this program, which is called the One Health Program, has reduced emergency departments visits by 51% and inpatient admissions by 70%. So in addition to providing the resources patients needed to be happier and healthier, we saw that the program was able to avoid over $11 million in costs to the health system. So really making a tremendous impact there. And another example comes from Chicago, where a task force of nurses designed a program called the Rush Surplus Project to reduce food waste and food insecurity throughout Cook County in Chicago. They partnered with community-based organizations like food pantries to match extra food that they had prepared at the hospital with people within the community that needed that food. Since 2015, they've donated over 20,000 meals to homeless individuals on Chicago's West Side, and they've been able to reduce food waste from 75 pounds to 30 pounds per day. So nurses didn't only start that program, they continue to play a really active role even today as that plays out in Cook County. But it doesn't really stop there. You know, even in the pandemic, we saw a lot of places where nurses stepped up and took on new ventures to help make sure that communities and patients had what they need. So due to PPE shortages at the start of the pandemic, nurses at University Hospital Ventures started a do-it-yourself fabric mask initiative and collected and distributed more than 100,000 masks in less than a month, which, as you and I both know, that was such important work at the beginning of the pandemic. And throughout the pandemic, nurses have played a role. And as we sort of come into what I hope is the home stretch of the pandemic, nurses are having a lot of conversations with patients around the COVID-19 vaccine and ensuring that their patients and communities are confident in that vaccine so that when they have the opportunity to access it, they will.
Thanks for sharing those examples, Priya. Just a snippet of all of what nurses are doing all over the country to really make sure that in different ways they are impacting the health of our nation. And let's not forget to mention what nurse leaders can do to address the systemic causes of social inequities. We know that that leads also to poor health.
Absolutely. We need nurses to be advocates for change. I'll just give an example related to maternal and child health, which is an issue that both of us are working on at the AHA. We obviously know that maternal mortality and morbidity is a problem in our country, and it is a problem that is faced more severely and acutely by women of color. And there's many causes for this. It's being driven by societal factors, structural racism, and implicit bias. But nurses and nurse leaders can play a significant role in improving both cultural competency and reducing implicit bias for the workforce. This includes engaging leadership in conversations and recognizing implicit bias as it's happening. Nurses can also be advocates for offering implicit bias training to all staff members so that staff can recognize biases and create action plans that can ensure care is delivered in an equitable way as we move forward. For example, Robyn, the AHA has partnered with the March of Dimes to help share their implicit bias training called Breaking Through Bias in Maternity Care. And it's a unique in-person and virtual learning experience that provides authentic and compelling content for our healthcare providers that are caring for women before, during, and after pregnancy. And this is a great place where nurse leaders can bring this training to the other nurses and other clinicians that are involved with providing care to women before, during, and after pregnancy. So it is a way that nurses can be working together to improve health equity. And before we conclude, Robyn, I do want to hear your thoughts on the ways nurses can empower their organizations to address health inequities as they move forward, and the ways that hospitals can empower their nursing workforce to lead health equity efforts.
Thank you, Priya. I think you just mentioned the key is that there really truly is a partnership. So nurses and their healthcare organizations really do need to work together. So, for example, continuing to screen and assess their patients for social needs in all their interactions. Nurses have so many touch points with patients. So this has to be top of mind, the assessment for social needs as they deliver care. And then once they get that information, how do they then make sure it is captured and acted upon? The hospitals and nurses need to invest in cross-sector collaboration and build partnerships, not only internal, but, as you mentioned earlier, with social agencies, with, governmental agencies. There's a lot of resources that just need to be coordinated. I think we've learned in the pandemic that, virtual care really has transformed some of the ways we think about delivering care. Doesn't replace hands-on care, we know that, but it can certainly enhance the contact that we have with our patients. So, nurses can lead virtual care practices to expand access and quality of care. Nurses need to continue to advocate, that word again. We know nurses are great advocates, but they need to advocate for interventions that address societal factors and policies that increase access to care to vulnerable populations in support of diversity. Nurses and their healthcare organizations, really need to look at the patient data. They need to take a deep dive to understand the various factors that influence a patient's health. And I would say that this needs to be individually, but also in aggregate. So there's a lot of power in looking at data across a subset of patients, for example. Look within to be part of the solution internally. So we need to understand from our own nurses, from our nursing perspective, what is our understanding, not just the nurses, but the whole care team? What's our understanding of healthcare disparities? And we need to then offer education to the nursing workforce and the entire workforce that is involved in healthcare to make sure that we have some self-awareness and awareness of our patients and our public. Finally, I'd just like to mention that the National Academy of Medicine's Future of Nursing Report 2020 to 2030 is being released this May, and I'm really excited about it. We will learn much from the report. It will contain lots of recommendations regarding the role of nurses, not only in responding to the pandemic, but really to improving the health status of our communities.
Thanks, Robyn. And I'm really looking forward to seeing this report as well and seeing how it influences the work of nurses as we move into the future. I also just wanted to mention, I think one of the things that I've seen as one of the biggest silver linings from the pandemic is collaboration. And you touched on the importance of collaborating amongst professions with the leadership of hospitals, with community stakeholders. And we've also seen a lot of unique collaborations with businesses. And so I'm also looking forward to seeing how those play out in the future and the role that nurses can play in keeping those collaborations going so that we can continue learning from some of the things we did well throughout the pandemic. So with that, we will end our podcast. And for those of you that are listening and would like more information, please visit www.aha.org/The Value Initiative and www.aha.org/Societal Factors for more information on the topics that Robyn and I just discussed today. Thanks for listening.